In this video, we will review the mobile app for the Axxess Home Health solution. When using an iOS device, go to your App Store, and when using an Android, go to your Google Play Store. Search for Axxess, and then choose the Axxess Agency Core app. Download and open the app. Next, you will receive a notice asking if you would like to allow Axxess to use your location while using the app. Tap Allow so that the app can have access to use the user's location while using the app. Allowing this feature is critical for the app to be able to pinpoint the user's location accurately for electronic visit verification, which will be covered later. Next, you will receive a notice asking if you would like to receive notifications. Tap Allow so that Axxess can send notifications, including alerts, sounds, and icon badges, depending on how the app notifications are configured in the device's settings. The login screen will appear next. Enter the email that was provided to you by the agency and the password that was established while logging into the web version of the home health solution. If the password was forgotten, then tap the Need Help hyperlink. Then tap on the Forgot Password. This will send the password reset instructions to the email provided. The version number of the app will also be listed at the bottom of this page. When ready to log in, enter the email and password, then select on Secure Login. When logging into the system for the first time, you will receive a welcome message and select OK. Create a PIN, then re-enter to confirm the PIN. Anytime you leave the app and come back, or the app times out due to inactivity, the PIN must be re-entered. The app will then open to the home page. The main part of the home page will have an announcement that Axxess might be promoting. To see these announcements, tap on the Get Started Today button. Towards the bottom, you will have three main components of the app: My Messages, My Schedule, and My Patients. Below these is an electronic ID badge. Select the badge to upload a picture of yourself or display for patients. Select Done to return to the home page. Select My Messages to enter the messaging center. Here you can create new messages or see any messages that have been sent, received, or deleted. Any new messages will have a blue dot to the left. Tap on a message to view. Select the delete icon in the bottom left of the screen to remove. You can toggle between the inbox, sent box, or deleted box and search for any email in any of these boxes as well. From the inbox to the top right, you can select Edit, then multi-select emails to delete by selecting a delete option at the bottom of the app to remove the selected emails. From the inbox, select the Compose icon in the bottom right to compose a new message. These messages can only be sent to other users inside the agency's database. Tap inside the To area and start typing the name of the user who will receive the message. A list will drop down below and become more limited while typing. If the message is patient-specific, tap inside the Patient area and begin tapping their name. Enter a subject. You can tap on the attachment icon to add any documents or pictures from the device. You will have an option to take a photo from the app or choose from the photo library. To return to the home page, select three horizontal lines to the top left. This is your Menu tab. Select Home or choose another main tab you'd like to view. From the home page, select My Schedule tab. Here you can toggle between the past due, upcoming, and completed visits. If needed, to the top right, you can select the refresh icon to get the most up-to-date schedule. You can also search for a particular task in the search bar. Each task will show the patient's name, visit type, visit status, and date. To the right, you can download the note by selecting the blue cloud for offline documentation. Scheduling a task is permission-based. If you have permissions to schedule tasks and activities, to the bottom right of the screen, there will be a plus icon that says New Task. Tap on this icon to schedule a new task. Select the patient, the episode, the date, the task, and the user. Then select Add. To the bottom left of the screen is a calendar icon for a monthly view. Any day with a task scheduled will have a dot at the bottom of the day. Tap on the calendar day to show the task scheduled for that day. Tap on Show All in the top right of the screen to show all tasks, and tap on the List button to go back to the list of view task. Tap on either the left or right arrows to toggle between different months. Tapping on a particular task listed will go to the task menu. From this screen, you can view any visit history of notes that have already been completed. You can go to the patient's chart, begin your visit documentation, or view any orders and care plans. Just below that, you can start electronic visit verification or document on a missed visit. You can select a Q code or location code for your patient, view any personal notes, visit comments, or episode comments. To start visit verification, select Start Visit Verification. You must be within 1,500 feet of the patient's home to provide electronic visit verification. You can then go into your note and start documenting by selecting Visit Note. If there is a note that has been completed and you have the View Previous Note permissions, you can select Load Previous. A list of previously completed notes will appear. Select the note you would like to preload information from, and a warning will populate asking if you are sure you want to load the visit note. Loading a previous document will erase any existing changes. Select Yes, an alert will populate saying the previous note has been loaded. Tap OK. You will still need to enter a time in and a time out, travel time in and out, associated mileage, or surcharge amounts if required by your agency. You will need to enter all of those items as well. You can choose to add a physician last visit, then enter any vital signs taken, and navigate through the assessment, editing any information as needed to complete your note. You can expand or close each section. You can enter items such as infection control forms or communication notes in your visit. Homebound status and medical necessity will pull over from the last OASIS document that was completed. These items can still be edited. Under Health and Management section, you can review your medication profile. Once in the medication profile, you can add a new medication. Tap on Add New Medication, start typing the medication, and select Search. Select the medication the patient is taking, add an amount, the physician, medication classification, and if a med is long-standing, select the toggle and the start date will go away. If it is not long-standing, then choose whether it should be new, changed, or unchanged. Select the start date and only add a discontinue date or date through if you know the exact ending date for that medication. Add the frequency and choose if you would like to create an order that would go out separately for the doctor to sign, or if no additional order is needed. When complete, select Done or add another medication. Interactions will automatically run. At the top of the screen, you can select interactions to be able to view for any minor, moderate, or major interactions. Selecting the individual medication interactions will open for further description of the interactions. After viewing, select the back arrows to return to the medication profile. To discontinue a medication, select the medication, then discontinue medication at the bottom of the screen. To reactivate a discontinued medication, Select the medication and select Activate Medication at the bottom of the screen. Next, you can sign the medication profile by selecting Sign Medication Profile. Finger sign on the line, then select Done. You will then return to the note to finish completing your documentation. You can address problem statements, interventions, and goals by selecting Plan of Care Profile. Here you can select a problem statement, then select Document on the interventions and goals to add those comments to your visit note. You can discontinue interventions here or resolve goals as well. When documenting a narrative, if you select the text box, then select the microphone on your keyboard, you can talk to text. You can edit a supply worksheet, add your supplies that you took out to the home for that visit. Start to type out the supply and then select Search. Choose a supply from the drop-down. Enter the quantity and the date. Then select Complete or Complete and add another. Return to your visit note by using the back arrow. When your note is complete, select Complete to the bottom left-hand side. Here you will be able to add your signature date, signature time, and select Complete again to finger sign your staff signature. Then select Accept Signature. Note that OASIS assessment documentation can be documented on the app. However, when complete, select Save and Exit. Log out of the mobile application. Log into the browser version, run the OASIS scrubber and OASIS check prior to submitting your OASIS. Once you have finished your note, before leaving the home, from the task menu, select End Visit Verification. The app will populate the visit's details as well as the patient address, the visit start location, and the visit end location. You will see all pinpoints on the map. Select Verify Visit. The next page will populate boxes to confirm the clinician and visit types as well as the date and time the visit started and the date and time the visit ended. The patient will finger sign, then select Verify Visit. A box will ask if you would like to verify the visit and select Yes. Now close that task on the top right of the screen. Once visit verification has been started, you can also cancel visit verification or mark visit as missed visit. When selecting a missed visit, you may then choose if an order was generated, if the physician office was notified, and select a reason for the missed visit. Then add any additional comments as needed, choose the date, and sign. Select the Menu tab by selecting the three horizontal bars to the top left. Choose Home to go to the home page or select the next major tab to view. Under My Patients, you can view and search for any patients that have been assigned to you. When you select your patient, if a picture was uploaded on your patient's chart, it will appear on the top along with general information such as a date of birth, medical record number, gender, a payer, and a payer ID. You can select Info and rerun eligibility and view any pertinent information. If you have permissions to add, edit, delete referral information, you will have an option to select Edit to the top right hand of the screen. Now you can go in and select any of the referral information and edit as needed. Select Save to the top right or Cancel to the left. Back on the patient's chart, the second circle underneath the patient's main information is a call option. This provides you with one-touch calling to the main contact number. Select Call or Cancel. The third circle under the patient information is a map. The third circle under the patient information is a map option. Selecting Maps will open your maps on your device for easy GPS options. Just below this is an allergy section. Here you can view any active allergies or deleted allergies, as well as add new allergies. To add a new allergy, select Add Allergy, enter the allergy name and allergy type, then select Done or Add Another. Next, on the patient's chart, you can view the primary diagnosis. The orders icon, when selected, will display a list of orders that have already been created. You can add a new order by selecting Add Order. Select the physician, the date, the time, effective date, and if the order is for the next episode. Select which physician to send the order to, add an order summary, and then choose your order type. You have medication, plan of care orders, discipline frequency, or supply manager orders. The other orders would be for any narrative regarding the order. When complete, select the signature time and then complete. Finger sign your name and then tap Done. You will be notified that the order has been completed. Select OK. Select Back on the top left. The next icon is Medications. This will take you to the medication profile. Under the Caregivers icon, you will get a list of clinicians that have seen the patient. Select the clinician's name for one-touch calling. The physician icon, when selected, will give one-touch calling for the physician, and same for the pharmacy and emergency contact. The communication icon will show you any communication notes that have been added to that patient's chart. The next icon is for visit history. Any documents that have already been completed in the system will be listed here for you to view. Select the document to get a print view of that document. The last icon is for immunizations. From here, you can see any active or inactive immunizations that have already been documented on the patient's chart, or you can add a new immunization or a new declination or contraindication of an immunization. Select the back arrow to the top left until you see the 3 horizontal menu bars. From the main menu, you can also see the Help and Support section. From here, you can call or email the support team. See a list of frequently asked questions, software updates, or access an ICD-10 lookup tool. Next on the main menu is the My COVID-19 screening section. When selected, a pop-up will appear stating consent is required. The infectious disease profile accesses your level of risk contacting the infectious disease as an employee. Verify your consent to document this information by tapping Accept. Then tap Add COVID-19 Screening and fill out the screening responses per your agency's policies. Once all questions are answered, select Save and exit to finger sign the Select, then select Done to the top right and close. Under your home screen, the last option is to log out of the mobile app.